This public service announcement is brought to you by Bradley P. Track. It's about polycystic kidney disease. Polycystic kidney disease is a kidney disorder that is passed on by genetics in families in which kidneys can form multiple symptoms. PKD, other known as polycystic kidney disease, is an autosomal dominant trait. This means if one parent carries the gene, then 50% of the kids have a chance to develop the disorder. It can occur in both adults and children. However, it's more common in middle-aged adults. About 1 in 1,000 in America have PKD. But there could possibly be many more because not all show the symptoms. There is also a recessive trait that also exists. This form appears in babies and children. It's very serious and progresses rapidly. Usually it results in kidney failure. Most children die from it. Tests for the disease. Well, there's certain tests. There's urinalysis. There's a CBC blood test. There's an abdominal ultrasound. There's abdominal CT scans and abdominal MRIs. When one has PKD, they have to think about the effects that it might have on children. The pros of having children when you have PKD are the children has a chance of never getting the disease. If children gets the gene, it may never develop the disease. The cons to having children when you have PKD are the children, you could get the gene and the disease, but the disease would not show up till middle age. The children could get the recessive form of the disease and die from kidney failure. The disease would cost lots of money in medical bills and medication. PKD affects global communities by worldwide more than 12.5 million people have the disease. Again, this could probably be more because not all show symptoms. In America, the disease affects 600,000 Americans. It affects men and women equally. It affects all races, and it even affects children, like I said earlier. There are many foundations looking for economic help by needing money for research for a cure, drug research for the disease. These foundations hold many fundraisers to help gain support for the disease and the money needed for the cure. Socially, PKD affects millions of people worldwide, and foundations can help by holding fundraisers and getting information out there about the disease. Foundations can get legislative support. People can go out and volunteer and go to benefits, walks, and other fundraisers that may help educate and fund foundations that will help find a cure. Again, this public service announcement was brought to you by Bradley P. Track, and I hope that it informed you about polycystic kidney disease.